Hello, hello. Hi, Amanda. So mine will be a pictographic presentation only on the behalf of the medical administration. I thought of at least providing some reports, some information on this International Nursing Day. Now, the International Nursing Day is a day in which we remember Florence Nightingale, who can be considered as the pioneer of quality. The quality started from the Crimean War, where the patients used to die, soldiers used to die due to the infections, and it was the Florence Nightingale who had engineered how the wards should be placed, how the sisters should be there, how the nursing desk will be there, how the beds has to be arranged. It was actually the plan, it was actually the idea of the Florence Nightingale. So on our birth anniversary, we remember this day as a International Nursing Day. Now I have taught all of you two things, that is called one thing in the nursing administration, what we follow, what you all should follow is otherwise known as benevolent autocratic. You are autocratic but benevolent. These two words have some meaning. One meaning is that I respect you, sir, please come, please see your patient. But on the other hand, you are authoritative, don't touch my patient without washing the hand. So these are the two meanings. In one hand, you request the patient party to come over. Yes, sir, please come and see. That is called benevolence. And the autocratic means, no, sir, you cannot touch my patient without washing this hand. So these are the two words, autocratic, benevolence. There is one thing. And the other thing, what we have always taught you is the Tolevinian model. That deals with what? Structure, process, and outcome. So these are the two things. Now, going to my slides. Today's International Nurses, the topic is our future, the economic power of care. This is the slogan. This is the motto. So what does it mean? If somebody asks you, what does it mean? Our nurses, our future. It is our future. But the strength is, we will create a healthy people. We will create a healthy society. And that healthy society will develop, drive the healthy economics. If the society is healthy, then there will be economic growth. That is what it means. So the simple meaning, we will make our society healthy, we will serve the people, and these people will become a healthy environment. Healthy environment will lead to economic growth and development. Correct? So this is the meaning of the slogan. Next slide. This was given by the nursing superintendent of Apollo Hospital. The condition of the nurse. Nurse is just like hanging on the tree. If nurse go that side, doctor is a snake which bites you all the time. This is the one example. On the other hand, if you go down, the crocodiles will eat you. On the other hand, the head nurse, your CNS or the management is always trying to cut you off. Understood? Yes. Come to my room. Come to my room. We will put suspension, but there cannot be any suspension. Suspension is not a solution. We all no punitive action. This is what the empowerment. I have no power to undermine her, but this is what the slide means. Slide means that we nurses are in a very typical condition. When a patient dies, then if you tell something to the doctor, doctor is going to bite you. If you go down and surrender, yes sir, this happened, patient will go to beat you. If you confess something, then what happens? The management is trying to take actions on you. So this is a very typical condition in which what is important is nursing empowerment. So that is the need of nursing empowerment. What does nursing empowerment mean? Suppose, in a ward, one of a renowned orthopedic surgeon has admitted a patient for bilateral knee replacement. In the night you find that this two legs are paralyzed. Is there a need of bilateral knee replacement? Can anyone question that? So at that point of time you should be able to question that, sir, this is not required. Knee replacement is not required because both the legs are paralyzed. This is what we call as a nursing empowerment. Next slide. Now, if we go to the modern medical team, what does this team contains? We will have utilization manager, billing supervisor, insurance, all these things, and only 2 persons, doctor and nurse, are a very small team. This is what the modern team. So we have to take, all the nurses have to take this role as a case manager, as an insurance agent, as a discharge planner. Nursing has to take over this power. That is what the meaning is. So the modern medical team, today I have no explanations, I have only pictures. Number 3. So empowering the nurses, leaders, empowering others to touch the world. Next slide. See. So strategies for strengthening the nursing is scale up, skill mix, healthy work and innovation. Do some nice work and try to innovate, try to find out fresh ideas to improve. Next slide. Yes. Now this is the nursing infographics. What does it tell? It tells 40% of the nursing time we spend on documentation. Care coordination 20%. 40-20 gear. What is care coordination? अरे अल्ट्रासाउंड टेक्नीशियन को बोल रहा है, अरे उसको बुलाओ, अरे डीडीए को बुलाओ. So this is care coordination, and वो डॉक्टर को बुलाओ, डॉक्टर बोल रहा नहीं, आरएमओ को बुलाओ, वो बुलाओ, इसको बुलाओ. So that becomes a care coordination, and 40% is documentation. And a very small time is left for this to patient care and assessment, only 40%. These are international studies, this is not my study. Next slide. So this is the anatomy of the nurse. Intelligence, communication, emotional awareness, physical endurance, groundless and patience. Next slide. Nurse bullying. अगर कोई ने आपको, first of all, do not feel bad about yourself. Somebody blames you. Do not feel bad about yourself. Point 1. Educate yourself. जाके पढ़ो क्या है. Educate yourself. Did I make the mistake? Was it justified? Educate yourself. Then confront your bully. मुंह में बोलो, no sir, this is not. I have done the right thing. If you are right. Keep a journal. That means you should educate yourself always. Keep a journal. And if at all the things are going wrong, inform your manager or HR in writing. This is all to avoid your bullying. So bullying has to be avoided. We cannot tolerate. Endurance is not the thing. We cannot tolerate. If I am right, means I am right. Next slide. The benefits of investing in nurse and nurses. This is about the high returns. They contribute to social cohesion, peace and prosperity. Strengthening the healthcare system is critical. Next slide, Manager. Which we will be planning out in the next few months after the elections, after getting a healthy atmosphere. We will be putting one project, and that is the Mission Shakti. And that is what? That community engagement by the nurses. That means, next slide Baji. इसका बने the main motto is, आप लोग कहीं भी जो गांव से आए हुए हो, हर एक जगह में there should be a point. जैसे कि suppose in Bakura in one place, जयपुर ही सोचिए, उस place में मेरे घर के बगल में बहुत सारा पेशेंट पाती है. सब बोलते हैं आप मुझे थोड़ा उसको दिखा देंगे, इसको दिखा देंगे. So that is what we call, I want to make the nurse to be the point of contact. तो अपने गांव में छोटा छोटा कैंप्स करेंगे हम आपके गांव में along with the medical team so that you also get empowered and patients का भी फायदा हो and on the other hand we get patients also. This is what the mission Shakti, this already is active in Orissa. So this is the term mission Shakti that we will be trying out, and so with this I finish my all the slides and thank you all and hope and wish you a happy Nurses Day. Thank you.